What happens in the posterior area when you start to lose teeth and you don't do nothing? You don't place implants. The problem is the bone is going to start to shrink. And the bone, once it shrinks vertically, the problem is that you're going to be having trouble here. And you will not be able to perform an implant because if you want to put an implant here, you're going to perforate the sinuses. And you don't want to do that. You don't want to perforate the sinuses. So some doctors, they say, hey, let's put some bone grafting, but you cannot go deeper than probably of a centimeter, just a couple of millimeters. But that's going to be a very small implant. So what happens on this area where you have this is the first of all is that you need to put implants at the moment that you lose teeth. Yes, that's the most important thing. But what if you didn't do that and you have no bone here? And there's so many patients that they say, hey, I don't have no bone. It was the condition at that moment. I cannot do much. And what can I do? Well, there are some techniques like this one, like the all 4, where you can do tilt implants like that. And this is a demo, obviously. And you can have long implants, which they don't go all the way to the nose, obviously, but they go there, they go tilt. And that's the way that it works. That's why this technique, you're having an implant placed in lots of bone because you can have lots of bone on this area. It can be tilt and it works really good, but it requires obviously a special training to do this, and you don't get to mess with sinus. You don't want to have that. You can have a tilt implant, and that sounds logical. Many doctors they say, hey, this does not work. It's because probably they're not trained on that, but that's the way that it works. And when you have this, it works really, really good. So do your homework and do your research about the all 4 and how it works and how it can give you a good benefit if you don't have no bone on the posterior area. Do your homework, Dr. A. Bye.